This episode mentions mental health challenges like depression, anxiety, and bipolar disorder. Please listen with care. If you feel like you need support, we've got resources listed in our show notes. This episode also talks about therapy apps. TVO does not endorse any of the apps mentioned in this story.
You're not a burden on anyone, and it's a bunch of bullshit if that's what you think.
Hey, I have a brain hack for you. Oh, by the way, I'm Karen. I study the human mind. I teach people how to rewire their brain.
One of the contradictory things about trauma is that typically people who experience trauma are extremely hypervigilant and anticipate the worst, but struggle to actually prepare for it.
Therapy is paying off because I learned this life hack and it has forever changed my life.
This is In Our Heads, a TVO Today podcast about generation distress. I'm Tiffany Lam. You just heard a little sample of things I tend to scroll through when I lurk TikTok. It's not super often, but it does happen. Both my TikTok and Instagram algorithm has me plugged into its mental health spaces. I'm not sure how or when this happened exactly, but I'd be lying if I said it only started when I began making this podcast. When I look on my Explore tab on Instagram as I write this, there are infographics like 4 tips to control your thoughts, 4 gut instincts you should not ignore, and I love this one, 7 red flags in yourself. But if I'm being honest, I've picked up easy mindfulness activities on TikTok. I've tuned into an occasional ASMR-fueled meditation for better sleep. And if I'm really confiding in you, dear listener, I think TikTok and Instagram infographics here and there have reminded me how and when my emotional needs and/or anguish are valid. Therapy gave me a better grasp of that notion, but social media regularly pointed it out. To be very clear, I'm not saying that what you read or hear online is solid medical or therapeutic advice. TVO isn't either. But what I am saying is that medical professionals have told me that the need for scalable mental health care is urgent.
The public's need for mental health services far outstrips anything that the public, the government could ever offer.
That's Dr. O'Neill Bhattacharya.
My pronouns are he, him, and I'm the Frigon Blau Chair in Family Medicine Research at Women's College Hospital. I'm a clinician scientist and practicing family doctor, and I lead a group called the Institute for Health System Solutions in Virtual Care.
When Dr. Bhattacharya tells me that meeting demand could be an uphill battle, I wonder whether something like content on mental health TikTok or Instagram could ever be part of the solution.
If you could never meet the need with, in-person or even like human-managed services, you actually need light touch services like apps, like internet platforms, and so forth.
Now, Dr. Bhattacharya isn't a therapy TikTok influencer or anything like that. And therapy TikTok and Instagram are not the light touch services his organization is studying. By light touch services, Dr. Bhattacharya is referring to what his field currently calls, quote, low-intensity services. It essentially refers to care that can require fewer medical professionals' hours and oversight. Something like therapy apps can fall into that category. And it has the added benefit of being mobile.
I started getting more involved in apps in the last, I would say, year and a half when I went through a big life upheaval and a physical therapist really wasn't going to work. So I decided to try an online one. My name is Darian Solander. My pronouns are she and her. I am a fat queer woman living in Edmonton, Alberta. I'm diagnosed bipolar.
Why didn't you feel like the physical therapist would work?
Mostly due to my schedule. Just that I was running around a lot, but also that I didn't feel like I knew where I was going to be in 2 weeks. Like I didn't feel confident that I could make an appointment and stick to it. And I needed more than just like every 2 weeks, an hour in an office. I needed something more personalized to myself and closer.
Bipolar disorder can cause extreme mood swings. One moment, you feel strong, confident, and full of energy, and then the next, you're in the pit of a depressive, sluggish low.
Your brain is covered in static, and like there's this staticky nothingness that just kind of takes over. And for me, it takes away my drive to do anything. And it just feels like this constant, like, reminder of like, oh, but what's the point?
If you're a regular podcast listener, you've probably heard of an app called BetterHelp. So many podcasts have BetterHelp ads. BetterHelp is available to Canadians across the country. And about a year and a half ago, Darian decided to give the app a try.
And I did feel real changes in my own thought patterns. I was better able to recognize when I'm in a lower mood and that negative self-talk comes in, and how to shut that down, and also like how to check in with myself and be like, oh, have I eaten? Is this happening because I actually haven't eaten yet today? So yeah, it was good for stuff like that as well.
The promise that digital health solutions seemed to show dovetailed with an unprecedented time that required remote healthcare options. And so in March 2020, the early days of the pandemic, the government of Ontario invested $24 million into a privately owned app that, in theory, would give Ontarians free access to therapy. Not BetterHelp, but a similar app called MindBeacon.
So what we really did was take CBT and make it available through the internet.
That's Dr. Kush Amaria, a psychologist who works as senior clinical lead at MindBeacon. MindBeacon is an app that offers CBT, or cognitive behavioral therapy. Cognitive behavioral therapy is an umbrella term for talk therapies you can get with a trained and licensed mental health professional.
If you're a young person looking for help, you think you're depressed, you think maybe your anxiety is getting out of control, you'd come to mindbeacon.com. You'd start by doing an assessment. And in that assessment, we'd really come to understand what your main symptoms are. We come to understand where, these factors are interfering in your life, kind of understand a little bit about who you are. And based on that, really be able to give you feedback right away about whether our program is right for you. Based on that, really what happens is that individual is matched with a therapist who guides them through this customized course of learning and activities and tools that they develop over time and at the pace that makes sense for them.
One thing that struck me as a little different about MindBeacon was how people could communicate with their therapist. MindBeacon offers virtual video conference sessions, but they also offer therapy via text messaging.
We may have our questions about whether you can really build a connection with somebody that you aren't talking to face-to-face, that you're only interacting with through text-based messaging in that sense. And the reality is we know that just isn't true. People find, anecdotally, you find the love of your life online.
You probably eventually meet the love of your life offline, but I take her point. Meaningful relationships can be built over text, and MindBeacon isn't the only app to use texting as a way to communicate. BetterHelp offers texting too, and young people like Darian found it helpful.
I'm basically in constant conversation with my therapist. Like when I have thoughts during the week and I think like, whoa, maybe I've just recognized this pattern in myself, I can reach out right away to her. And I know that I could like write it down and bring it to a therapist later, but I also know that I won't do that. So this way I can reach out right away with that fresh thought. I can hear it reflected back to me in a different way and see if that fits. And it's just really nice to have that access.
The feeling of having constant access to her therapist, even if she doesn't actually, has Darian feeling more cared for on her own terms. And she's consistently also thinking about her mental health and well-being.
I don't have the luxury of like kind of like letting go and just not doing the work. Like I have to do stuff like mood tracking, and I should be in therapy most of the time. It just like I know that my mental health affects my life enough day to day that if I'm not on top of it, someone who I love, like my family member or a friend, will have to do it for me. So it's a bit of a personal responsibility thing, but also like I also get to spend a lot of time learning about myself.
Not to mention, the texting helped her level with the mental health professional she works with.
We don't text a lot with like professionals or anything, so it really did immediately kind of make me feel more like her peer rather than like a traditional therapist who I would feel like quite a bit of distance from. And the fact that like sometimes she would answer right away, sometimes it would be a couple hours or whatever, but there was always a response. And I mean, my experience with medical mental health stuff is like sometimes you send an email and you just never get a response. And so it felt like that responsiveness was so nice. It felt a lot like what I was doing was important. It was worthwhile.
As a researcher, Dr. Bhattacharya noticed this too. This method of communication seems specifically well suited for this proverbial generation distress, youth coming of age today.
Asynchronous interactions actually are a medium that speaks to adolescents, right? They're like they text more than they phone. A modality that is, fits in you do it at your own time, at your own pace, and is asynchronous, I think is inherently, so it's scalable because you don't need someone on tap all the time. But also, I think it's well suited to that population.
According to Dr. Bhattacharya's research, about a third of MindBeacon's users were post-secondary students. At MindBeacon, there's no set playbook on whether you get linked to the therapist through live face-to-face calls or text messaging.
Sometimes it's hard to explain what comes first, what's the order, because there isn't one. It really is dependent on what that individual needs at that point in time.
Dr. Maria says texting her clients can still follow cognitive behavioral therapy's model and be part of that continuum of stepped care. Stepped care is a model of care that calls for a central intake where people can then be directed to a range of options that's aligned with the severity of their symptoms and their own readiness for that treatment plan. Navigating between the steps should be easy. And this model has not been adopted everywhere yet.
A big part of cognitive behavioral therapy is understanding your thinking to determine how it impacts your feelings or impacts your behaviors. And if you can first learn how to identify some of those thoughts, particularly the faulty thoughts that are probably leading to those negative emotions, then you can practice figuring out how to change them.
To be honest, I've had my qualms with CBT. Sometimes it felt like I was talking myself out of my feelings, which I'm not really sure is the goal. Regardless, MindBeacon offers CBT through readings and exercises. Therapists guide users through said readings and exercises through the in-app texting or real-time phone calls or video calls. Presumably, the therapist would put these exercises into the context of their lives' stressors of the day. For MindBeacon's leadership team, this approach made financial sense.
It's a lower cost service to whoever's paying for it. I'm Colin Anderson.
Colin was MindBeacon's executive VP who headed up its public sector practice, so anything to do with its connection to the public healthcare ecosystem. He's an economist by training, and he was also Ontario's former deputy minister at the Ministry of Finance under a Liberal government, specifically Dalton McGuinty's.
So whether it's an individual, a government, a hospital, or something like that. So you're not occupying a full 50 minutes or an hour of a therapist's time, which frankly is expensive and adds up over a course of treatment. You're having multiple interactions in a week, but they're short interactions with your therapist. And so it's called low intensity because it's fewer minutes at a time, basically. They're able to message their therapist on an unlimited basis 24/7, and then she'll get back to them and keep them moving along. And so you really help engage people and keep the momentum going.
Colin is not at MindBeacon anymore. After 6 years, he decided to step down from his role there for personal reasons. Now, the thought of having that kind of access to my therapist sounds like it could have been helpful. I remember being pretty anxious about whether emailing between sessions was overstepping. I worry about MindBeacon therapists being burnt out. But Dr. Ameria says,
I think the feedback from our therapists is that they really do feel like they can help many more people in the times that they have available. If I'm a therapist doing traditional talk therapy or traditional CBT, 8 clients a day is a lot. That's 8 hours. But if I'm working in this sort of model, maybe I can support double, triple that number in a day. Because each client will have a different level of need at that time. Maybe one individual does need a little more clarity or guidance or feedback on one of their, activities they're working on.
MindBeacon's team found it had other advantages too. The remote nature of the service meant more therapists on their roster. Here's Colin Anderson again.
One of the advantages of using a digital service is we can rely on therapists who maybe live in Vancouver but are licensed here in Ontario. But it means that you can have surge capacity and specialization.
That said, one therapist who's licensed to work in Ontario isn't sure about joining this roster.
My pronouns are she, her, and I wear a couple different hats. So I am a therapist by trade, but I also own a group practice in Calgary, Alberta, and we practice in Alberta and Ontario and a few other provinces.
We asked Simone Saunders whether she would ever be a therapist on MindBeacon.
My instinctual answer is no, and the reason why is because I really value that in-person virtual sort of connection, which is why I personally don't provide phone therapy or anything like that. For me, there's a lot that gets missed if you don't have access to body language, facial expressions, all of those different things.
Conversely, I think picking up on the tone of my therapist's advice would be important to me too. So much communication can be lost over texting.
And so while it definitely might be helpful for some people, I think there would be definitely missing pieces for me in terms of being able to provide kind of care that I would want to provide.
It's true that MindBeacon was helpful for some people, but truthfully, it was hardly a majority. The team that Dr. Bhattacharya, the family doctor leading studies into therapy apps from earlier in the episode, his team found that for those living with anxiety, almost 1 in 5 people saw reliable improvements in their symptoms. About a quarter of people showed reliable improvements for symptoms of depression. A textbook on psychotherapy from Brigham Young University in Utah notes that studies have shown that 75% of patients who undergo a year of treatment can see significant improvements to their mental health. That's over 50 sessions, but it also said that improvement can be shown in as little as 8 to 10 sessions. That's 50% more people who benefited from psychotherapy compared to what Dr. Bhattacharya saw in MindBeacon. It is worth noting that the book's copyright is from 2002, so the landscape has changed a lot since then. The app, and arguably CBT more generally, is also not meant for people who are in immediate danger to themselves or others. Here's MindBeacon's Dr. Ameria again.
You need to have safeguards in place. And so we do have some exclusion criteria. If somebody is identified as having suicidality crisis in the moment, certainly at the time of assessment, we're not the right place to offer them support. We're not a write-off completely, but what they need at that moment in time is something different.
By the summer of 2022, Ontario Health announced that the app wouldn't receive the same level of funding anymore. MindBeacon seemed to have not met the government's metrics of success. The app originally received $24 million over 2 years when it was first contracted. That's $1 million a month to provide cognitive behavioral therapy to Ontarians over the internet. It was made available during the peak of the COVID crisis and shutdowns in March 2020, a time when in-person therapy was not an option. Today, instead of $1 million a month, MindBeacon is being given $3.75 million over 2 years in government funding, effectively an 85% cut. We asked the MPP for Vaughan Woodbridge what had happened. He's the Associate Minister of Mental Health and Addictions. Here's what Michael DeBolo had to say about why the government decided to drastically reduce MindBeacon's funding.
MindBeacon is one of several programs that were put in place during the pandemic to ensure that there were supports when supports basically had dried up. Psychologists and psychiatrists were not seeing patients. We really felt the need that something had to be put in.
In an emailed statement, Colin Anderson, MindBeacon's former executive VP of all things public sector, said what had been free online therapy that supported 60,000 users dropped to 9,000 users. More than 50,000 people losing access to free mental health care certainly doesn't sound ideal.
We are making investments that are tied to performance. So these are metrics that we are developing. There hasn't been any in the past. Fidelity to the modality of treatment is one metric.
By fidelity to the modality, I think Minister DeBolo is referring to the extent to which people stick with the app and complete its therapy program. A modality refers to a method or process a therapist will use to reach a goal with the patient. I asked Dr. Amaria whether the app struggled with retaining their users.
It's a risk in any type of therapy that's delivered, and so it's not unique to ICBT. Sometimes people drop out because they're doing well, and we don't even think of that sometimes, right?
I wanted to underscore that point because people do focus on completing all the content, and we do encourage people to do that. Our therapists encourage them to keep on going. But you do have people who are busy and they're like, well, I feel better enough now.
MindBeacon didn't offer more exact numbers beyond that. But according to Dr. Bhattacharya's research, out of the cohort who started the program, about a quarter of those who started the ICBT completed more than 75% of it. And then another quarter of people didn't even complete the first 25% of the programming. Minister DeBolo also said that symptom reduction is something that the government considers as well.
The other metric is the outcomes for the individual through the program that they're in.
But you might remember that Dr. Bhattacharya's team found that out of the users who signed up for MindBeacon, almost 1 in 5 people saw reliable improvements in anxiety symptoms. About a quarter of people showed reliable improvement in depression symptoms. Again, hardly a majority. But that said, Minister DeBolo wasn't clear about what the threshold for success for an app was. If a quarter of people showed reliable improvements in depression symptoms, is that good enough for the government? Does that quarter of people who didn't complete the first 25% of programming mean MindBeacon had failed? Minister DeBolo made it sound like what's considered a successful tool was a bit of a moving target right now. Where the government is focusing their energy on this file seemed divided.
There are a lot of tweaking that's going on because one of the concerns we have is, for instance, how are we moving the individual between the school and the community-based supports? How are we working to ensure that there's the movement of information?
On one hand, the government needs to lay the groundwork for mental health care that can most efficiently communicate with all the other systems it's connected with. Here's Colin Anderson, the former VP at MindBeacon, on that.
They recognize that there's an impact on people. There's impact on the healthcare system because people are showing up in the emergency rooms. There's an impact on the justice system. There's an impact on the economy with lost days off work.
And yet, on the other hand, the opportunity cost for investing in systems infrastructure could mean fewer resources going into the immediate, front-facing mental health care to individuals. When I asked Colin Anderson why funding from the government got cut, he said that the government wanted to refocus towards a system they had started to build before the COVID-19 outbreak.
Basically, they wanted to resume the Ontario Structured Psychotherapy program that had started before COVID, which is an integrated program where patients can access a bunch of different services, group, one-on-one, a variety of things. And so the idea was put people into that referral process, and maybe they need high intensity, because the COVID program was only MindBeacon, ICBT. We didn't have the ability to send people to other services.
Colin said he was hesitant to characterize the loss in funding as a cut because MindBeacon is still a part of the Ontario Structured Psychotherapy Program. They just get less money now.
So it was always anticipated that the one program would come to a close and then the new one would begin. It did mean that for a period of time there were people who probably could have benefited from a service that weren't able to access it.
At this stage, MindBeacon's clinical lead, Dr. Ameria, is hopeful. Despite the impact that defunding MindBeacon has had on their business and the 50,000 Ontarians, at least people now know that mobile mental health therapy is an option.
I don't want to call it necessarily brand recognition, but the understanding that ICBT is a valid way to treat everyday mental health issues. And maybe it's the universities that step up next and say, yeah, we want to make sure that ICBT is accessible to our roster of students. And again, MindBeacon's ready to go. Here we are. Yep, we're ready.
And Dr. Bhattacharya, well, he seems to think that the experience with MindBeacon demonstrates how we need a firmer idea of what role governments should play in the mental health space. For him, MindBeacon's drop-off rate was illustrative. He compared MindBeacon's offering to faulty plumbing.
Along the way, lots of people are dropping out, probably because they need something else. Maybe it does something for them, but not everything. And so if you think of it, it's like a leaky pipe. Because people are dropping out because it's not meeting their need.
But Dr. Bhattacharya doesn't seem completely discouraged by the impact digital solutions can have.
Phase 1 was this. And you laid out a program, you learned a ton of things. For phase 2, really, the idea is to take that intake assessment out of it and not give it to a vendor and say, okay, the province is going to do the intake assessment, to then figure out what you need and then develop a more comprehensive program. But the next phase will be to build that platform and then plug a bunch of things into the platform as you go.
Darian, the BetterHelp user we spoke with earlier in the episode, alluded to how having just one app to support all her mental health needs would be great.
I have a hard time finding an app that works for me that really caters to what I need as far as I want to be tracking different moods and also different habits. And I kind of space it out between a couple different apps. But I've never found one that really works for all the things I want to track.
That's so interesting. Would you like it if there was just one?
Yeah, I would. With my mental health situation, I want to track how often I'm feeling depressed or how often I'm feeling suicidal. And those are day-to-day counts. And I also want to track how many days am I brushing my teeth this day or not? I haven't found anything that's really worked for me yet, but could be out there.
Remember that therapist who said she wouldn't be on MindBeacon's roster? Just to bring it full circle, Simone Saunders actually happens to be part of the therapy TikTok ecosystem that my algorithm has me plugged into. She'd said that MindBeacon didn't quite meet the threshold of the kind of care she wanted to provide. I wondered if she considered her social media content as part of that care.
I see it as strictly psychoeducation.
Psychoeducation refers to the practice of teaching people about how the brain thinks and functions. In my experience, therapy can involve psychoeducation, but more specific lessons relevant to something I was experiencing.
So the way that I have described it before in some of my videos is use it as you would a self-help book. If you're deciding to buy a self-help book, that does not mean that you have a therapeutic relationship with the author or anything like that. Take the things that you find are helpful and leave the things that you find are unhelpful.
Simone has a strong sense of how her social media self and her therapist self are different. As a person's therapist,
I have a good understanding of their history. I have a good understanding of, who they are as a person, whether that's when I first meet them or, 2 years down the journey. I also am able to say okay, based on my personal competencies, I can work with whatever issues that they're bringing into my session.
But as a mental health content creator,
I don't have that capacity. There's a lot of times where I probably don't know who the people are who might be commenting or asking questions. And so even when questions are asked, I'll always give general advice because, again, I don't know your specific situation. I don't know your relationship with your family, with your friends, with yourself.
Simone is a content creator in part because she finds that there's still a level of privilege from being able to access therapy.
It's accessible is my biggest thing, is that it can reach a lot of people and it's free.
I wondered what she thought about the risks of youth these days self-diagnosing.
Self-diagnosis is valid in a lot of cases because getting a diagnosis is a really privileged experience because it can be, whether it's very costly or you're going to need individualized treatment or what have you.
Darren agreed that getting a formal diagnosis was very privileged. But she did wonder what a self-diagnosis could do to young people's sense of self.
I know that for myself personally, when I first received my diagnosis of bipolar, I went around for a long time just thinking of myself as a sick person, like just thinking like, oh, I am like a damaged person. And that's not true at all. It's not true of anyone. So I think that element of like seeing yourself as broken or different in a bad way than the general population, to unlearn that is really difficult. And it just, I know for myself, when I labeled myself as sick, it was kind of an excuse to like, okay, well, I don't have to do anything anymore. And it doesn't matter if I accomplish anything because I'm a sick person.
Unless a family doctor prescribes you a therapy app, MindBeacon Today will cost users roughly $525 for their 12-week program since the conservative government ended its funding. Most traditional therapy today can cost roughly between $90 to $250 a session. So depending on how many times you're seeing them within a 12-week period, MindBeacon still is the more price-effective option. But psychoeducation on social media may be a great way to drive those costs down even more, and maybe even reach people who didn't realize that they needed it.
If I were to write a book, for example, that could reach a certain amount of people, but it would have to be people that are already interested in that topic, et cetera, versus social media. I come across information every day that I'm not necessarily looking for, and I'm like, wow, okay, I didn't know that.
Much like internet consumption generally, Simone recommends a healthy dose of skepticism for things you see online.
I think that always encouraging critical thinking around what is this person saying, and does what they're saying align with the things that, like my values first and foremost, but also is there a sense of like this feels right or this feels wrong?
That said, Simone does have advice for people like me consuming mental health TikTok or Instagram. She has some green flags to look for.
Is their content culturally responsive? Is it gender affirming? Is it inclusive? I think is like the biggest word, because I think you also would want to have someone who kind of aligns with your same values.
These green flags might all need to be checked off to count towards sound stepped care that mental health professionals are excited about. Self-directed information gathering is step one. And so it's actually valid to be out there and looking for more information on how to work through your feelings of the day, and that can be part of mental health care for yourself. But the big caveat here for online content whose source you don't fully know.
So the only thing I want to reiterate is just kind of like responsible social media consumption, and really, really being curious about that for yourself, because I know myself, I have definitely gone down into the spirals of like excessive social media consumption, especially because I'm on it for work. And so I think that when you're not super attentive to that, you can spend a lot more time than either you intend to or than is probably healthy on social media. So I think creating balance for yourself, make sure you're thinking critically, make sure you're questioning things even from people that you absolutely trust, and do your own homework, do your own due diligence.
Next time, in the final episode of In Our Heads, we speak with someone who's on the other side of addiction.
I was almost always under the influence, right? So that seems to kind of mask the mental health disorders that today I'm facing with a mind and a body that is free of substance.
And we'll learn a little more about the program that helped him get sober, Healing with the Land.
Within the land-based treatment model, it's really about creating stabilization, emotional growth, resilience, and looking at creating success in the wilderness setting. It's 4-season programming, so we operate rain or shine. Our executive director famously says it's an outdoors program, not a sunshine program.
Thanks for listening. We tried to lighten the mood and focus on a potential solution this episode. But if you're feeling like you need help, you can always call Wellness Together Canada at 1-866-585-0445 or text wellness to 686868 for youth or 741-741 for adults. We'll also list more resources in our show notes. In Our Heads is hosted and written by me, Tiff Lam, and co-produced with Matthew O'Mara. Matthew and I also reported and edited the show. This show also relies on reporting from Generation Distress, an investigative journalism bureau series published in the Toronto Star. The team is led by Robert Cribb, Declan Keogh, Julia Fioni, and Charlie Buckley. This episode had production support from Anna Spencer, Carla Lucchetta, Nikki Ashworth, and Jonathan Hallowell. Shahriar Tajvidi is managing editor of podcasts and digital video. Lori Few is executive producer, digital. And John Ferry is VP of Programming and Content at TVO. Thanks again for listening.